is Gregory Hyson. I'll be your doctor for today. What's your name?
Well, okay, that's good. First of all, you're speaking to Dr. Adam, who
Uh,
is your intermediary.
uh,
So how you doing?
Good.
Yes. So you see your patient clearly?
Yes.
Okay, okay. So what do you want to know about your patients?
Uh, well, like, what brings you in today? Like, what things have you been
Okay,
going through?
okay. What brought her to the hospital is she is having symptoms of fever,
Uh-huh.
abdominal pain, headache. Actually, these are the symptoms that brought her to the hospital.
Okay. Has her fever been on and off or anything?
The fever has been continuous.
Okay. I have an idea what it is, but I also like to I like to do a hemoglobin test also, just to
Okay,
make sure.
we wish, yeah, we did the hemoglobin test and it came out to be 15.
Okay, she's good. She doesn't have anemia or anything.
Yeah,
Okay.
so we've thrown anemia away. Okay, so
Uh,
let's continue.
uh, could we test her blood culture?
Yes, we did a blood culture for her.
Um, uh, does she have typhoid or anything?
Well, okay, the blood culture came out to be positive. So what's the interpretation?
She has typhoid,
Yes, okay, that's correct.
and for her treatment, she needs to take some antibiotics,
Okay, that's good.
and for prevention, make sure she she has like good hygiene and like you stay away, like try to eat good foods and sanitation, like have good sanitation or whatever.
Okay, okay. So, Dr. Gregory, I hope I'm right. I'm calling you rightly.
Yes,
Yes, okay. You started well, but from the symptoms were already driving you to a diagnosis, isn't it?
yes.
You get me? Yes.
Mm.
Okay, one other good thing you did was that you asked for the hemoglobin of this patient because she may or may not be anemic, isn't it?
Yes.
Yes, and you should have asked other symptoms, whether she has cough, running nose, leg swelling, shortness of breath. You need to, ask all those questions. You shouldn't just stick to one thing, or maybe most of the symptoms the patient asked you, then you just keep to that. But one other important thing that you said that I really liked was that you wanted to know whether this fever is continuous or on and off. So because
Okay.
by the time you say on and off, it takes you to one other side. By the time it says continuous, it takes you towards typhoid, isn't it? That's why I say you already have an idea. So that means you may not really sometimes waste your time on a patient where you don't really have when you already have a diagnosis. So, but then you need to confirm the diagnosis by doing a blood culture, which came out to be positive. So the next thing is to treat a patient. Because by the time you get it, you make a diagnosis of your patient, isn't it? You
Yes.
have already made about 80% of the management of this patient.
Mm.
So the remaining 20% is just the antibiotics you're going to give this patient and the preventive measures because you don't want this patient to come back with typhoid again, isn't it?
Yes.
Yeah, so good sanitation, hygiene, washing your hands before and after feeding,
Mm.
and then you watch what you eat.
Yes.
Very important because if you're not sure what you're going to eat, you don't eat it. Either a food or a drink,
Yes.
isn't it?
Yes.
Yeah, it's just like for example, I open a bottle of Coke and I've already opened it and I left it there for hours and I just come and give you. Will you take it? You wouldn't, because you don't know what must have entered into the bottle. So, but
Mm.
when it is comes sealed, you open it yourself. You're sure that
Yes.
yes, it's not contaminated. So that's it. So it's always important to watch what you drink. It's just common sense.
Yes.
And yes. So, doctor, you've tried so much. Keep it up. That's an excellent job.
All right. Thank
At
you.
least your patient now is going to get better.